So the next speaker is Dr. Oleksandr Kovalenko from Ukraine. And his presentation is devoted to some very new apply again of Guna medical devices, namely injuries under work conditions.
Yes.
Yes, okay. It's your turn now.
Thanks for this opportunity. Let me introduce our experience in treatment of patients with polistructural gunshot injuries of the extremities.
Please, doctor, closer to the microphone.
Okay.
Thank you.
The use of up-to-date weapons during the war in Ukraine has brought about the rise of severity of gunshot injury. The character of gunshot injury has changed towards heavy polystructural damages accompanied with vast soft tissue defects. Problematic questions of surgical treatment of injured on the level of special care is soft tissue defects closure, the change of bone fracture, methods of fixation and addition fixation with AEF, bone defects plastic, nerve repair, restoration of segments function, orthopedics corrections. Rehabilitation of patient with polystructural trauma and without. Patient without with isolated injury lasts an average of 3 weeks in the acute period and up to 12 weeks in the active rehabilitation phase, as you know. Patients with polystructural have an acute period 4 to 8 weeks and active rehabilitation up to 12 months and more. Up to 19% of patients with an isolated injury fully recover within 6 months, and only 5 to 16% of patients with polystructural return to their previous level of activity within 1 to 2 years. About 20% remained with long-term functional impairment. In the cases of a combat injury, this percentage will be even higher. From 2014 to 2022, more than 1,000 military personnel received surgical treatment and rehabilitation at the Institute of Traumatology and Orthopedic in Kyiv. From February 2022 to November 2024, more than 12,000 militaries were treated at the Institute of Traumatology and Orthopedics, and more than 1,500 of them underwent inpatient and outpatient rehabilitation in our department. All patients after polystructural injuries at the rehabilitation stage and after long-term limb immobilization face the problem of contracture. In the case of polystructural trauma, contractures have a combined nature such as dermogenic, desmogenic, myogenic or myofasciogenic, and neurogenic combined. Depending on the severity of the injury and the number of damaged structures, rehabilitation tactics also changed, including MD collagen preparation were combined. Most often we used MD collagen injection, MD tissue, matrix, muscle, and neural. It depends of character of damage and symptoms, such as contracture, or it can be neuropathic pain. Statistic of the rehabilitation department of the Institute of Traumatology and Orthopedics. Since March of this year, of course, we start treat patients by MD collagen since 219, and we have a lot of patients with military trauma. But our research, we start since March of this year when we had taken invite to this conference. So only 52. Number of patients by anatomical zone. And of course, we have a lot of patients with lower limbs, but in this research, we show you only upper limbs. By anatomical zone, the most popular is elbow joint and forearm, then carpal and hand, and then is shoulder. Monitoring protocols were created. The patient's condition was analyzed according to the increase in function. The evaluation of the function was carried out with the involvement of 2 complementary methods. DASH, as you know, disability of the arm, it's functional model and a little bit subjective, but modified system AOS is more objective that can analyze like angle of active movement, passive movement, and dynamometry. Pain syndrome was evaluated using a visual scale WASH, as you know and use. And let me show you some cases that could be interesting for you. And you know, such 2019, we had a lot of patients after crash, a car crash. So it can be useful for you, for patients not only with military trauma, but after car incidents, including. Right, because though they have two polystructural trauma. This patient born in 1979, condition after surgical treatment, date of operations May 6, 2024, open reposition metallosteosynthesis of 3 to 5 metacarpal bones of the left hand with bone plastic from the wing of the iliac bone, suture of tendon of extensor 3 to 4 fingers, carried out for fracture of other carpal bones, state after the explosive trauma, 2nd August 2023, condition after the Ministry of Internal Affairs of 2nd August regarding a gunshot fracture of the 3rd to 5th metacarpal bones of the left hand. When we start, we have a big contracture, better position of first finger, and he also have a neuropathic pain. I will show you first injection we do at 14 July of 2024. Results after 6 injection, we see a better movement. We do injection under the skin, near the tendons, and 1 time to the skin and tendons, 2nd time near the medial nerve. Next patient is 47 years old, fracture of the body, diaphysis of the radius, gunshot shrapnel wound of the left forearm, gunshot multifragmentary fracture of the diaphysis of the left radius, soft tissue defect, the state after the PHO in the core AZF, trauma, 70 December 2022. He had a lot of phase of his reconstructive surgery and rehabilitation parts, and he have not good results last 6 months. But then he come to us, and we start to do, of course, rehabilitation with our multifunctional team and injection of MD collagen. First injection 70 May 2024. He also have a neurogenic contracture of nerve radius. And then we analyze results after 6 injection of MD collagen 21st May. As you see, we see results, but when patients come to us, they told, first, what we see, it's our skin change the color. It's getting better getting better mobility. Then I went to Germany on my practice, and my head and colleague Borzik Natalia continued to treat this patient, and we had an opportunity after 1 month rehab to see his mobility, tendon mobility and skin mobility, and even he starts to make a physical activity like health people. I repeat, mean explosive injury 70 December of 2022, and he can't do it before we start. Next patient, consequence of mine explosive injury 11 December 2023 injury, amputation stump of the proximal third of the right shoulder, open multifragmentary fracture, a defect of both bones of the left forearm at the stage of surgical treatment, consolidating fracture of the middle third of the diaphysis of the left ulna, condition after metallosteosynthesis, fracture of the left radius with an exciting bone defects at the level of the middle third of the left forearm, neuropathy of the median nerve also, paralysis of the left hand. When we start, we make an injection near the medial nerve and near the scar, under the scar. Some patients have a very painful scar. In this case, we start to make injection near the scar. When the scar is not innervation and don't have big pain, we can do injection inside the scar and under the scar. Results after 8 injections of MD collagen. As I said, change a color of scar, better mobility, tendon mobility, better functional, because he has only left hand, he don't have a right hand. Mine explosive, 11 December 2023, so more than 6 months. Next patient, 27 years old, consequences of a minor explosive injury, consolidating gunshot fracture of the lower third of both bones of the right tibia, gunshot multifragmentary fracture of the distal epimetaphysis of the right humerus with displacement of fragments, fracture of the proximal metaphysis of the right ulna with displacement of fragments, chronic post-traumatic osteomyelitis of the distal epimetaphysis of the right humerus condition after osteosynthesis in IAF, and of course he have a lot of polystructural trauma of lower limb, but it's not the term. So we start our injection 14 May 2024. He has a dermal part from his body. You may see a very bad mobility and dermal scar is not painful, but he make a really big dermatogenic contracture. So we do injection near the skin transplant and under the scar. Result after 4 injections of MD collagen, you can see a bigger angle of his movement. And yeah, we continue to make injection, and now he's feeling very, very good. And let me introduce a clinical case of Borzeich Natalia. She is an orthopedic microsurgery, and this patient, she make a rehabilitation and she make a surgery of this patient. She knows them more than 5 years because some of these patients are our patient from 2015. So, polystructural severe gunshot injury of the upper limb with a tissue defect, elbow defect, repair with a spacer and vascularized flap of the latissimus dorsi muscle, followed by endoprosthetic and the use of MD collagen between the stage of reconstructive intervention. After the operation, you can see this transplant. Natalia started to make injection after 6 months. After latissimus dorsi transplantation, and this study of rehabilitation we do before make an endoprothesis of his joint. It makes in Germany. Polystructural gunshot injury defect plasty with rotational dorsal forearm flap, sliding flap or ulnar bone, application of MD collagen after reconstructive intervention. 2. In this case, after 12 months, we start to do application of MD collagen, and we have a great results to make a better mobility, flexion and extension of his hand. Polystructural gunshot wound of the shoulder, multifragmented gunshot fracture of the middle third of the left humerus damage to the radial, median, and ulnar nerves. The condition after transposition of the thoracodorsal flap to the area of the shoulder defect and tendon muscle transposition and the use of MD collagen between the stage of reconstructive interventions. We treat this patient until this time. And we also have a great result to treat a hernia, lumbar hernia between L5 and S1 level, also with MD collagen and other rehabilitation kinds. So operations make in 2018, and today we see great results of movement of his left hand. Polystructural gunshot wound of the shoulder, multifragmented gunshot fracture of the middle third of the left humerus, damage to the radial. I think it's 2 months ago. Results, I told, because he had a lot of parts of rehabilitations since 2015. And polystructural severe minor explosive injury of the hand with a tissue defect, revascularization of finger, plasticity of tissue defects using the type of MD collagen reconstructive intervention. In this case, Natalia started to make injection after 3 months after operation. And we have such a great results as you see. Conclusions. The expediency of a differentiated approach with the use of an injectable tropocollagen preparation of MD to achievement the maximum desired and results of providing specialized care to victims with polystructural gunshot wounds of the limbs as a conservative treatment after restorative intervention and between stage of reconstructive operation has been proven. The increase in the function of the limbs in the wounded who received rehabilitation according to the developed plan was significantly greater and was achieved 65 plus minus 18 days less than in the wounded in the comparison group. The increase in function was 48 points. Pain reduction was noted in all patients with damage to the peripheral nerves of the limbs. According to the analysis, in patient whose pain was 10 to 8 Vash points before the start of treatment, after the third to fifth injection of MD collagen, it decreased to 7 to 6, and after the 10th injection, it reached 4 to 3. And after 1 month, the effect was maintained and positive dynamics were monitored. Thanks for your attention. We have a great multifunctional team, and I'm ready to answer your questions.
Thank you so much. Thank you so much for this great experience that you and your equipe had on war soldiers or not soldiers injuries. I would like to ask you, you many times, I would say all the times in your speech, you have said MD collagen. Would you be precise what kind of collagen did you inject? Was it tissue? Was it matrix? Was it neural?
Generally, or in our research?
Yes, but a specific name of the collagen is matrix, tissue, neural, depending on the, and muscle, of course. Especially muscle, you mean?
Yeah.
Okay.
No, the most often for me, in my cases, I use matrix.
Matrix.
Matrix, right. And I combined it with MD neural. But Dr. Borzig like MD muscle, and she combined it with MD neural.
Okay.
I know that MD has a big part of metabolic part, but it's good, as for me, for make a pain lower.
Yes.
But tropocollagen in MD,
yes,
as for me, is more important, and it don't have a big matter which collagen we will inject it, because MD muscle and MD matrix has a lot of collagen and make a great result.
Yes, especially in poly-injured anatomical parts.
Yes.
Yes, thank you so much.